It's a very interesting and challenging domain, biomedical engineering. So it's a very, you can say, a old field, biomedical, but recently Zoom word, a buzzword for this deep learning and artificial intelligence. So that has also shown his uh, glorious research in the biomedical field. So today I will be talking on a specific domain of this engineering, biomedical engineering, that is an ophthalmology. So although it's a very small, you can say, domain or a department in the hospital, but it has a lot of opportunities for the engineers, for a lot of opportunities for the researchers in the ophthalmology field. So I'll be going through uh, aspects of ophthalmology. So biomedical engineering is a very vast field. So it has many, I can say, domain, starting from the instruments used in the hospital. If you see in the hospital, almost all the instruments are there, which are manufactured by engineers. And the basic purpose of all these instruments is just to aid the diagnosis and the treatment for the doctors, but not to replace the doctors. That is the main uh, debate between the medical practitioners and the engineers. So we will realize in coming few years that AI and its applications in biomedical engineers, they are just going to have such wonders where a need of the doctors will be very less. It will be reduced at a large extent. So we will be specifically talking on this medical imaging domain of this biomedical engineering main field. Apart from this, it has biomaterials, then prosthetic, rehabilitation, nanotechnology, and all many other things, many other fields are there. But as this FDP is specifically related to, or my topic is related to ophthalmology and its applications related to image processing as it is. Right. So to start with, ophthalmology is nothing but a branch of medicine which concerns with the eye, the anatomy of the eye, function of the eye, the physiology of the eye, and diseases related to eye. Typically, ophthalmology is not only related to eye, but it is also related to the eye and its signals that are sent to the brain, because all the signals from the eyes are processed into the brain. So in ophthalmology also there are many other such domains, like the image that is formed in the brain, whether it is forming properly or not, that is being handled by the experts in the ophthalmology called as a neuroophthalmology, right? So we'll be talking about the, and I'm talking in the sense of the engineering point of view, because there are many medical terms that we don't understand, but I will try to explain all these anatomy functions and the diseases and how we as an engineer can help this ophthalmology field for uh, the assessment purpose or for the prediction of various diseases. So to understand this disease, basically you must understand what is the anatomy. Once you understand the anatomy, then you will automatically understand how it functions, what are the different parameters related to proper functioning of all these systems related to ophthalmology. And once you understand that, you will be able to propose the solution, propose the algorithms, and you will be able to uh, give a proper uh, solution for a particular disease in a novel manner. So as an engineer, you are going to propose a solution. So for that, you must understand the anatomy and physiology. But the anatomy and physiology from the engineering point of view, that is very important, because the looking into the eye by the medical expert is different than the looking into the eye by such an engineers is very different. So I'll be showing all the details of the eye, its functions, anatomy, and disease from the engineering point of view, so that you will be able to understand that and you will be able to apply, uh, you will be able to understand and apply these by image processing algorithms for developing the many such algorithms. right? So I will be going through a short, very short anatomy of the eye. That is what basically eye is and what are the different parameters related to eye that we require as an engineer. What are the different imaging techniques that doctors follow for looking into the eye, for looking into. Am I audible, madam? I think some sound is coming there.
Yes, sir, you are audible, sir.
Yes. Yes. Okay, thank you. So, what are different imaging techniques that doctors use? Which are the main diseases, eye diseases? There are a number of diseases related to eye, but we will be going through the diseases that are uh, that can be detected using images specifically, because we are talking about or we are going to discuss about the image processing as such, and the AI part in the image processing. So many diseases are there, but I will be strictly sticking to the image processing related eye diseases, or the eye diseases that are detected using images. So I'll be going through quickly one of the case study to just to show you, just to give a feel of the role of the image processing in the detection of some of the eye diseases. Like in this case, I will be going through the diabetic retinopathy. So what type of images you have to take, what type of processing algorithms the uh, classifiers, and how the results and how we can help to the doctors by using the image processing algorithms. So we'll get a feel of detection of a disease through the image processing. And lastly, I will be throwing some lights on the future trends in these retinal diseases, the use of AI in retinal diseases, and they are the topics or the domains that are still open or still not touched, or very few research is going on in this field. So those who are looking for working in this particular field, so they can definitely go through further the topics that I'm going to discuss here, the applications that I'm going to show here, so you can explore that for the further research. So this will be my outline of the presentation. So as we know that our basic eye is what we see the world. It's very similar to the camera. So the reflection from the surface of the objects that are lights are passed through the lens using this brain, um, very similar to camera, is it? So if we look into the eye from the front side, we normally see these eyelids, the pupil, sclera, and iris. So this is the only way, or this is the only part of your body through which we are going to look inside the body, specifically for inside the body, specifically for looking for these blood vessels. So no other part of your body gives doctors an view and direct view of the blood vessels. So it's a very important part of your body to diagnose many diseases, not only related to eye, but related to other systematic circulation like the blood pressure, heart attack, and all many such renal related diseases also can be detected, which are such many open challenges, many open such domains are there, because we can see directly these blood vessels using this uh, or through this eye, through this pupil. So this is a cross section of an typical eye. What we see is different parts like this pupil, lens. So let's just quickly go through the parts of this eye which are required for detecting of the diseases. Okay, I'm not going in detail for all these things, but just a few points that you must know, so that you will identify the diseases and you can apply the algorithms for detecting of the disease. So we know that iris is the main part of the eye which gives us the color, and typically the color and the structure of this iris is basically used in many biometric applications like an iris biometrics. So it is basically going to allow this pupil to shrink or like open or consist. We have this pupil. This is the only part of your eye through which the light enters into the retina, and it allows to form the image. So Through this pupil, all the light in the sense we can see, or it allows us to see it. So it is entering the light and falling that light on the part of backside of part of your eye to form that fall that light on the retina, and these are passed to the brain as I mentioned. So this is the way, or this is the path, or this is the point from where we are looking, or this is the only way you can say that we can look inside the eye. So for the different purposes, like to find out the disease, to find out the health of your eye. So pupil is a very important part of your eye. Lens is what basically it is very similar to the lens of your camera. So it helps to properly focus the light on the retina. So it's a normally transparent one, as it has to pass all the lights. And as per the age, it's a normal case that it develops and clouding. Because of that, it forms a cataract. So typically, I can see as here, uh, the light gets fall from this lens, and it should fall particularly on this retina backside of this. But we know that there are the problems related to the eyes, that we can't see properly. It may be because the lens is unable to pass these light rays on this retina. It may be prior to the retina, or uh, behind this retina. So to correct this, we know that we use the lenses for that, and then the light exactly um, pass to the retina so that we can perceive the images, right? Also that we can see properly. Another important factor or parameter related to the eye that you must know is called as an vitreous humor. So basically a sort of fluid and liquid, a gel-like fluid, which is going to fill inside the eye. So it just forms and support for this blood vessels, none other than that. But changes in this fluid creates a lot of problem. So changes in the fluid in the sense, the amount of the fluid gets reduced or increased, or the pressure of the fluid gets increased or decreased, that causes many problems, many diseases related to eye that we'll see. Another important parameter related to the eye that we are going to normally refer for many diseases is an optic nerve head. So optic nerve head is basically what? This one, where this point is nothing but here at the back of your eye, where from where all the blood vessels and the nerve cells or the uh, nerves are going to enter into the eye, or you can say leave from the eye. So these are the blood vessels that enters into the eye. So the part or the point from where they enter into the eye, that is referred as an optic nerve head or simply an optic disc. So from here, the signal gets passed to these nerves through the brain. Typically, if we will see this, what this is called as an image, called as the fundus image. So in the fundus image, typically it looks like an yellowish in the image. So it's a full white. You can see this one in appearance for a healthy eye, you can say for healthy eye, right? So this is another parameter related to the optic nerve head, called as an optic curve, or simply called as an optic cup also. So this optic cup is basically important for detection of the glaucoma. Glaucoma is a disease that we'll see. So it forms a natural cup because all these yellowish points, yellowish lines you can see here, these are the optic nerves, and these are the blood vessels, right? So these blood vessels are supplying the blood, and optic nerves are going to carry the signals to the brain. So because of this structure, it automatically forms a structure like a cup. So it is called as an optic cup. So the size and shape of the cup may change depending on the condition of the uh, eye. Another important parameter, which is called as a fovea. Fovea is basically what? It is having a dense collection of these photoreceptors, and these are responsible for showing us or giving us a fine detail a proper color in the seen image. And the region around this fovea is called as a macula. So there are the diseases called as macular degeneration. So that is basically the effect or the problem related to this fovea and its surrounding region, that is a macular, or simply called as a macula. Right. So macula is another important factor part of your eye, which leads to certain diseases. A very important part of your eye is nothing but all these blood vessels. So like every other other cells of your body, the eye is also having its own cells, and all these cells receives or requires nourishment, requires the blood, requires the oxygen. And once they receive that, and they also needs to give off all the toxic products like the waste materials and carbon dioxide. So it needs two type of blood vessels. One is for supplying all these nourishments and oxygen, and other is to take off all that things and supply it to the, or take it to the heart, from where there it is supplied to the lungs and the kidneys. Is it? So as I mentioned earlier, it is the only way, or it is the only part of your body through which we can directly see this blood vessels. And these are all the extremities of the blood vessels. And the blood vessel plays a very important role in different diseases. So due to these blood vessels, there are many diseases. So identification of these blood vessels, proper detection of these blood vessels plays an important um, role in image processing based disease detection related to retina or related to eye. Right. So these blood vessels are excellent indicators for various systemic diseases like hypertension, diabetes, high cholesterol, or certain brain-related diseases, carotid diseases. All these can be easily seen and detected through the eyes. Right. So these are retinal vessels, or simply called as blood vessels. We'll see a camera which is called as a fundus camera, fundus photography. If you take the fundus image of an eye, normally it looks like this. So we are normally using this as an fundus, or called as an fundus images. So these fundus images are used for detection of many diseases. So this is a fundus image of a normal eye, which is captured from, so this is an opening with nothing but your lens, and opposite to this lens we have this optic head or optic disc. And from here you can see there are the blood vessels coming out of that. And this part is nothing but the fovea around this, as I mentioned, a macula, optic disc, optic center, and the blood vessels. So all these are the normal, you can say, parameters of the blood of the eye that we can see through this fundus image. So fundus image is an image, and normally fundus is nothing but the backside of your eye, backside of your or the behind the lens we have that retina. So looking to that retina is called as an fundus, and that image is called as an fundus image. To capture that image, fundus camera is used. Okay. So so these are some of the important parameters that we must understand before going through the automatic detection of various diseases, or before going through the what are the diseases and how to detect that using image processing algorithms. So let's go through what are various techniques that doctors use to see all the behind the eye or to into the eye. So normally, as I mentioned, the pupil is the only part from where we can look inside the eye. So generally, the pupil size is small. So if you want to look into this eye through this normal pupil, then you can see a small part of the eye or small part of the retina, you can say. So typically, doctors use the drops which are used or which dilates the pupil. So because of dilating of that pupil, you can see here, this is the size of the normal pupil, and by inserting few drops, which doesn't have any effect on the eye itself, but it dilates the pupil. So as it dilates means we can have a more window to look inside the eye. So you can see here. So this is called as a field of view. So we have a lot of field of view. So we can take 2 to 3 such pictures to see the entire inside of the eye. So typically, a dilated pupil is used for examination purpose. So a very basic tool that is used by the doctors is an ophthalmoscopy. So ophthalmoscopy is simply nothing but a lens system, and it is directly connected to the eye, and through the pupil it is adjusted to look inside the eye. That is, this is going to see the fundus itself, but a direct vision is there to the medical practitioner or to the ophthalmologist. That is an direct ophthalmoscopy. The magnified view of the fundus can be seen using the same type of ophthalmoscopy, which is an indirect ophthalmoscopy, in which it uses a separate lens system for towards the eye and of the medical practitioner and the eye of the patient. So a magnified view, but a small field of view is possible using this indirect ophthalmoscopy. So these are basically a special lens system to look inside the eye, which is a dilated pupil. So it is just to view, nothing to store or nothing to capture. So it's an ophthalmoscopy. So another important tool or instrument you can say used is an slit lamp bio microscope. So slit lamp means if you compare this with the earlier ophthalmoscopes, they just have the direct lens system, but to view properly and to view other so many parameters like whether the light gets fall exactly on the retina or before the retina, or to find out, or we can say that to find out the number of the speck. Normally they use this slit lamp biomicroscope. Slit is nothing but a small beam of the light, bright light is passed through the pupil into the eye, which is produced by the lamp, and we are going to view the inside of the eye through the or using some magnification that is under the microscope. So this is how doctor looks into the eye using this slit lamp microscope. This also doesn't have any record as such, but just to monitor, just to look inside the eye, right? Uh, this one is an imaging technique, you can say a tool imaging technique, which is an optical coherence tomography. It is very similar to ultrasonography. The only difference here is that in ultrasonography, we use sound waves. Instead of that, here light waves are used. So the reflected light is used to find out the location and the structure inside the eye. So here also, all the light rays are, small light rays are passed through the pupil. The reflected lights are captured using an instrument. So it is a non-contact, non-invasive to study the retina, the cross-sectional study of the retina, or other optical properties of the different tissues inside the retina, because uh, the ophthalmologists know that the properties of the retina, the property of the blood vessel, the properties of the optical uh, disc. So whenever there is an disease, the optical properties just change. So to find out whether there is a blood leakage or not, we can easily use this optical coherence tomography. So it is also a very interesting and challenging domain to work in, finding out many diseases using an image called as an optical coherence tomography. So there are many algorithms developed for qualitative analysis as well as quantitative analysis of the eye, of the retina. So qualitative analysis, it will give you the proper or exact, as compared to other many techniques, the location of various landmarks of the retina, landmarks of the eye, like the fovea, the carotid, then all the retinal fibers. So it's very accurate analysis can be done using optical coherence tomography, or to find out the exact thickness, exact location, exact border, or exact area of a particular parameter. Optical coherence tomography is very helpful in that case. Very widely used and easy to access the inside of the eye is an fundus photography. It is very similar to an ophthalmoscope, but it's an evolution, you can say, or next version of ophthalmoscope where a lens system to have a proper magnification of inside of the eye, and to record we use an the camera over here, so we can capture the images of the inside of the eye. So it's an fundus photography. So it gives us an image that is an 2D representation of three-dimensional retinal semi-transparent tissues. That is nothing but your backside of the eye. So it is nothing but an camera with special lenses. So the lenses can be adjusted to get a proper view. It can be aligned properly to proper view of a particular area of the backside of the eye. So such facilities are given. This is a sort of fundus camera and a patient, and the image is captured, and that we can analyze using a computer, you can say, right? So as I mentioned, this is an fundus image called as an fundus image, which gives us the all the landmarks, or we can see inside the eye. So it provides an upright and magnified view of the fundus. So basically, this is used by many doctors and as a screening, or normally when you visit to ophthalmoscope, they first go through this fundus photography to see the changes in the eye. So it's a normal process for looking into the eye, and it has an advantage that we can capture this image and store this image for further processing purpose, or we can send that image. So as you know, advantages of the capturing the image, so the same applies over here. The next very important, again a very less research has been done in this area of fundus fluorescent angiography. It's very similar to the fundus photography, but only the difference here is that procedure is different, as in case of fundus photography compared to this angiography. So angiography is typically used or followed for a patient of which blood arteries or blood vessel related diseases has to be detected very accurately. So it's very similar to, if you must have heard about the angiogram, heart angiography and all that things, very similar to that. Only difference here is that in case of heart angiography, x-rays are used, but here we can't use x-rays. It may harmful for the eye. So for that, a very good research has been done in this case, and camera, the same camera of the fundus image has been used to get the angiogram. So here, a fluorescent dye, basically the same dye. Some dye is used in the heart angiography also, but here the dye is different. The dye is an fluorescent dye, which is typically a sodium fluorescent, so which has certain um, light properties. So we or doctor insert this fluorescent dye inside the artery, and that blood circulation takes place through inside the eye. And once we emit the light inside the eye, so the light properties of this fluorescent dye gets excited, and after some time again this blood gets back, like it gets circulated back, and some blood, if it is leaking over there, may accumulate over there only. So after some time they are going to uh, emit the light in these lower energy levels, and these emitting lights are captured using the same fundus camera. So we get a proper image of the all the blood vessels properly. That is called as an angiogram. So angiogram is basically, uh, gram is nothing but the waveform or simply an image, and angio is related to the blood vessel. So a proper blood vessels, proper blockage in the blood vessels, the leakage from the blood vessels is accurately seen through only this fundus fluorescent angiography. So it's a very preferred medium for detecting uh, many diseases, for doing the surgery related to eyes, the such and fundus fluorescent angiography. It's basically a test, not a simple imaging technique. but because it's an, you can say, an invasive type of technology, because invasive type of photography, because we have to insert that um, this thing, fluorescent dye inside the blood circulation, right? So other type of the technology or the imaging technology, that was non-invasive one. So because of that, these are preferred medium. But if you want to confirm that this particular blood vessel is having a clot or it is leaking into the eye, the only way that you have to go through is through this fundus angiography. So they first go through the ophthalmoscope. If they don't find anything, then they go for fundus photography. In that, they feel that this particular blood vessel may be leaking over there. Then to confirm that, they follow this fundus angiography. So all these are the stages as in other diseases also. So it's an angiogram of the blood vessels of the eye. So it is an angiogram, right? So other techniques are also there, but are rarely used for detecting the diseases of inside of the eye. For example, ultrasonography, X-ray, CT scan, and MRI. So X-ray, CT scan, MRI, they are typically used to detect neuroophthalmology related diseases. Ultrasonography is rarely used, but to find out the physiology, the or the structure of a typical eye, they can definitely go for the CT scan and MRI related to, say, some muscles are there over the eye, structure of the eyes may be different. So for that case, they can go for CT scan and MRI. So I'm not going in that detail because in ophthalmology, mostly all the research, all the diseases are mostly detected using either OCT or using this fundus photography only. So let's go through some of the diseases that are very important from the research point of view, or where you can contribute in this ophthalmology field. So as I mentioned, there are many diseases, but I mentioned here the diseases which are easily uh, detected using the images. And because we want to um, apply the algorithms using the image processing, so other diseases are there, but I just included here which are related to image processing and AI related applications on this particular eye conditions or eye diseases. So for that, these are the major diseases related to eye. These are the major causes for the blindness, vision loss in many peoples. These are glaucoma, the cataracts, macular degeneration. It's also called as an age-related macular degeneration, and very important is an diabetic retinopathy. So I'll be quickly going through this, how to detect these diseases through these images that and image processing, and we'll be going quickly go through one of the case study for this diabetic retinopathy in further slides. So any doubt at this point? If you have, I can just wait for a couple of minutes. Otherwise, I can continue. If you have any doubt, I can clear.
Hello.
Yes.
Hello. Am I audible, sir?
Yes.
Yes. Question answers are
Okay.
means participants are posting questions, but
Okay. Okay. Fine,
may
madam.
not
Fine.
be
Yeah.
related. So one question I have, that can you please clarify what is the basic difference in fundus images and dicoma images?
DICOM image. So
Yeah.
DICOM image is basically an encrypted images. You can convert the fundus image to DICOM image. DICOM image consists of all the details of the image, the patient, and encryption. So these are normally used in medical fields for privacy purpose, for transferring that image, for sending that image. So fundus image is an direct output of the fundus camera, right? I can't see the questions because I have played the slide, right? So if you have any question, just let me know.
Yes,
Please.
actually, participants are posting me in my private chat box.
Okay,
Okay.
okay, madam, no problem.
Yes. So related question is this one. The general one we will ask at the end of the session.
No problem. Yeah. So I'll
Yes, sir.
continue with this. Yes.
Yes, sir. Yes, sir. Please.
So these are the diseases I will be going through: glaucoma, cataracts, macular degeneration, and diabetic retinopathy. So glaucoma is basically what, as I mentioned at the beginning, that we at the or inside the eye, it is filled with this gel type of fluid. So changes in this fluid, changes in the pressure of the fluid causes this glaucoma basically. So this, suppose for example, talking in the engineering language, if this pressure of this liquid, pressure of this fluid gets increased, so that pressure is going to say given on this retina. So because of that, the pressure, some of the neurons of this retina may be damaged. If this pressure is too high, in that case, this particular block, this particular part from where all these blood vessels comes and from where all these neurons or the nerve cells are emerging, it may be blocked over here, or it may exert that pressure. That may be the one problem. The another problem may be that due to this pressure, as you can see here, the blood vessels are very tiny blood vessels. Due to that blood vessel, these tiny blood vessels, so you can see here there are two sides now. One side, from this side the pressure is there of the fluid, and another side the blood is coming with some pressure from this blood vessel. So if the blood is coming from through the blood vessel with a lower pressure than the pressure of this fluid, then the blood may not be circulated. The blood may not be given to that cell, and because the cell is not receiving that nutrients, oxygen, or the blood, then that cell gets damaged. So this is because it's caused because of elevated intraocular pressure. So it is a loss of this neurofiber layer. So this is a neurofiber layer, right? So this layer is basically responsible. Neurofiber is what? Basically neuro is nothing but some cell related to carrying the information of the falling of the light to the brain, and it's a fiber basically connected network. So that is going to damage due to this uh, uh, elevated intraocular pressure. Intraocular pressure is nothing but the pressure of the fluid inside the eye. So, what doctors look into this? They are basically suppose if you have this ophthalmoscope, so they are looking specifically for this structure. This is an optical nerve head, optical cup, and they are specifically looking for the pressure of this fluid using an instrument called as a tonometry that we are not included. So using tonometry, they can find this pressure of this, but what is the damage or how much damage it has created? To detect that, they have to look into the eye for a particular special parameters, features. So these features are basically nothing but uh, the ratio. Okay, so you can see here, this is an white part is called as an optic cup, and around this there is an optic disc. So this ratio gets changed. So there are the normal ratios for the normal person, normal or healthy eye, and the ratio or this gets increased for the glaucoma related disease. In some cases, you can say this border gets faint. Okay, so you have to detect it automatically, this border, quantify this border that will grade the glaucoma. So optic nerve head variance, there is an neuroretinal rim loss. So this is called as a rim. Around this, there is a rim which gets lost because of this intraocular pressure. And this basically end of this optic cup gets fed or atrophy. That is called as an periapillary atrophy. So these are the landmarks, you can say, or the key features that we can look into the image to find out the glaucoma, or to um, grade the glaucoma, or to inform the doctor that how much loss or predict the loss. These are few of the image processing related applications you can say. So it causes damages the nerves as they lose eye, causing all the cells to be death of these cells. So it the normal healthy person can see like this, but a person having glaucoma loses its peripheral vision. So early detection of this glaucoma is very important to avoid the loss of the vision. So you can go for screening of this glaucoma also. That is one more important uh, domain of this image processing. So you can capture these fundus cameras, look for the glaucoma. Look for the glaucoma is nothing but look for these features related to glaucoma and suggest that whether a person needs some treatment or he is a normal or healthy person. So a glaucoma and early detection of the glaucoma is very important in ophthalmology field. So as I mentioned, cataract is basically it's a natural process, normally natural process, but not for all. So it's a clouding of a natural lens, and because of that, a person or the patient experiences a blurred vision or dim vision, and sometimes we see the glares or halos around the light. So these are some of the symptoms related to your uh, clouding of the lens. So clouding of the lens normally can be seen just looking into the eye from the front side, but it will show the clouding of the lens when it progresses to the advanced stages. So if you want to find out the early stage of this cataract so that the treatment can be done at a proper stage, we can go for image processing also. So image processing based cataract detection or early stage detection of the cataract is also possible. So clearing the lens, which is a natural one, which is called nothing but a clear lens, is something like that, and the cloudy lens is the because of it's a natural, basically a natural process of the eye, and depends on many other factors like the lifestyle and food and all that things. So, so typically a person having diabetes may leads to cataract, or many chances are there, or a direct exposure to the sunlight may causes clouding of the lens. So, as an if you can go through images of this, find out the clear lens, the cloudy lens, grade the cloudy lens, or simply finding the behind or fundus image, how the fundus image looks like. Based on that, also you can grade the cataract or screen the cataract. The another again a common type of disease related to eye is an age-related macular degeneration, or simply called as a macular degeneration. So it is mostly common for the old peoples. So it causes the damage to the macula. Macula is nothing but the surrounding of the fovea, as we have seen. So, and the macula is responsible for sharp and detailed central vision of the perceived image. So such lessons, which are in medical field called as drusen, can be seen for the patient with age-related macular degeneration or AMD. So to automatically detect this AMD, normally these are related to macula, so they appear near this fovea. So landmark has to be first detected, that is where is the macula, and around its certain diameter we have to look for this. So other such spots may be there apart from this macula, but they are not related to AMD. So that for because of that, finding out this fovea, finding out this macula is very important. So that is a landmark of this fundus image of the eye. So first find out that automatically, and then find out these addressions, and the quantify this lesson so that you can grade the AMD, whether it is slow, whether it is fast, or the stages you can say can be done using image processing and artificial intelligence. So a person having this age-related macular degeneration may perceive an image in which the fine details or the central vision is lost. So in medical field, this AMD are of two type: dry form of the AMD and wet form of the AMD. So wet form is an advanced, you can say, disease of this AMD, whereas at the early stage, you have to detect for you have to go for detection of this automatic detection of this dry form, and it's basically because of the damages of the tissues or retinal tissues. If the tissues are damaged, and they are also going to lead to damage of the blood vessels, and as the blood vessels damaged, it's a tendency of our body that the new blood vessels automatically regenerates, and these new blood vessels are very fragile. These new blood vessels normally tend to leak the blood, and that because of leaking of the blood, it may cause severe problems to the eye. So that is a form of wet form. Okay, so once a wet form rated AMD is started, means there are many chances or very chances are there to lose the vision. So uh, there are very untouched domains that to predict the AMD and to predict whether it will come for dry or to wet form. What is the duration? Okay, so like that, many such topics are there. If you understand this wet, dry form and wet form and their importance from the medical point of view, and how we can apply these image processing algorithms on this for prediction purpose, for suggestion purpose, that is, and one more domain you can work on. A very interesting topic and very common disease related to eye is diabetic retinopathy. So we Indians are almost at the top three in diabetes. And diabetes we know is basically called as also called as in diabetes mellitus. It is a group of disease basically due to the changes in the blood sugar, blood glucose. So a problem related to blood secretion, glucose secretion, or blood one second. Our body is unable to create or secrete this insulation properly, and because of that it creates many problems to most of the organs. And the very first organ that diabetes affect is your eyes. So you must have heard that diabetic peoples lost their visions due to this diabetic retinopathy. So a person having diabetes eye vision problem is called as a diabetic retinopathy. So it is a complication of diabetes to the retina. So and it's basically related to blood vessels and supply of the blood, specifically talking. And the next stages of this are the damages of these nerve cells. But specifically, it is related to the blood vessels and supply of the blood. So this elevated blood sugar level causes the vessels in the eye, blood vessels in the eye, to swell. So the blood vessels get swell, and because of that swelling, they get fragile, they cut, or they leak the blood into the retina. So you can imagine once the blood is leaked on the retina means that particular part of the retina is unable to receive the light, or their light falls on the retina is blocked because of that blood drops or tiny blood drops. And once that has started, the leakage of the blood into the retina or into the eye may get increased, and that may lead to loss of the vision. So a person having DR or advanced stages of the DR, you can see the image something like this, where these are nothing but the blood ruptures. So early stage detection of this diabetic retinopathy is very important, because it is said that almost all diabetic patients are lead to this diabetic retinopathy, and patients visit to the ophthalmologist once they reach to some certain advanced level, because at the early stage there is no symptom as such to visit to the doctor. But it is suggested by medical field in the WHO that the persons in above 40 age or having a diabetes has to check up all other parameters along with this eye for diabetic retinopathy twice a year at least, so that the DR can be detected at the early stage and it can be treated properly to avoid loss of the vision. So if you are going for an early detection of the DR or screening of the DR, doctors are specifically looking for the features. These are called as lesions, and these lesions are termed as microaneurysms, hemorrhages, exudates, and cotton wool spots. These are you can say the initial stages called as a non-proliferative. It can be cured, but the advanced stage is generation of new vessels, leaking of or cutting of these new blood vessels into the retina, into the eye. That is a proliferative type of disease of the DR, which is called as a neovascularization. So, uh, the lesions present in the eye in the form of non-proliferative DR are microorganisms. So, these microorganisms are nothing but very small blood drops or a swelling of the blood vessel. And these are the very first, you can say, uh, indication of this DR, and very difficult to identify by the doctors through the normal eye or through the normal ophthalmoscope. It's very difficult because the skill of the doctor's skill of the ophthalmologist plays an important role over there, because uh, the blood vessels and these microorganisms are very same in nature. It's quite difficult to distinguish between the cut of the blood vessel, the drop of the blood vessel from the actual blood vessel. And the sizes of these small blood vessels are very small, in the range of 100 microns. And once they are starting leaking the blood, it forms a rupture of the blood. So that is called as an hemorrhages. So both of these are related to a swelling, detachment of the blood vessel, and leaking of the blood. So these two lesions are nothing but these features. These are called as microorganisms and hemorrhages. So in medical term, they are called as red lesions because they are related to blood, and others are white lesions. So if we see typically in this fundus image, then we can see a very small. So if you see here, was very small blood drops are there, which are very difficult to identify, called as microorganisms and hemorrhages. So as I mentioned, to confirm this whether these are microorganisms or not, the only procedure that we have to follow is an angiograph, fluorescent angiography. Okay, fluorescent angiograph. The other lessons related to diabetic retinopathy is exudates and cotton wool spots. So exudates are related to leakage of the lipids and proteins, so which are yellowish type of protein or lipid gets leaked into the blood. That is due to this leakage of blood and proteins called as exudates. I will show you that. And cotton wool spot is basically it's due to the lack of blood supply. As I mentioned, some of the nerve fibers gets damaged or they die because they are not able to receive this nourishment in the form of oxygen and oxygen and the blood supply. So they are going to damage these nerve cells. So you can see here shiny type of yellowish spots are there. So these are the exudates, and cotton wool spot is nothing but something a very flare uh, without having any exact boundaries, but faint image of this cotton wool spot can be detected for this detection of these lesions. So you can go for automatic detection of these exudates. You can go for automatic detection of these cotton spots, or for the grading, these lessons has to be found. So at the early stage, only microorganisms are seen. At the further stage, when there is a lot of blood is ruptured, hemorrhages can be seen, and when the a lot of blood is going through for falling or leaked, along with that blood it also leaks the lipids and other blood into the eye, then it gives us the exudates, and because of that the nerve cells gets damaged, that will causes this cotton wool spot. So to identify all these automatically, we need to understand the exact structure of this. So it may lead to very false positive for this because of the capturing techniques, because of the noise, right? So accurate algorithms needs to be developed for this development of automatic detection of the lessons related to DR. Right. So I'll be quickly going through one of the a case study related to this automatic detection of DR in retinal fundus image. So before that, uh, and machine learning algorithm typically requires, or typically we implement using certain stages, as all of you must be aware about, that we capture the image, we pre-process that image, and if you are looking for a particular disease, then we have to first identify the candidate regions, and from that candidate regions we select and features related to that lesson or related to that decision or disease, and then these features are used for training of the classifier, and the classifier is trained for a particular lesson or for a particular disease. For the testing purpose, the same sequence is followed, and then we may come with a very good or an excellent algorithm to identify the disease, or to identify, automatically identify the um, lessons in the image. So these are typically the landmarks, as we have already seen. Optic disc needs to be properly identified, right? So that I mentioned here. So typically in general machine learning algorithm, we use this pre-processing for enhancement of the images, for a shade correction purpose. So typically in if talking about the DR detection, we are looking for blood vessels and related lesions. So the color fundus image is normally, or from the color fundus image, normally the green plane is selected because we have a proper contrast between the green plane, or we can see the proper contrast in the green plane. So green plane of the image is used for further processing. So you can see here how the blood vessels can be easily seen, or the contrast of the blood vessel with the background is easily seen over here. So shade correction, contrast enhancement, certain such pre-processing tasks are applied. In the pre-processing stage, many other diseases like glaucoma or AMD that requires detection of certain landmarks like the optic disc or optic cup. So automatic detection of this optic cup, optic disc, the quantification of this is required, the diameter or the ratio of this optic cup and optic disc is required. So all that should be done automatically. So for that, we must know what exactly optic cup is, what exactly optic disc is, how to find out the ratio between these two to find out an appropriate lesson or to detect the disease automatically. A very important task in the specifically in the DR detection is to extract the blood vessels accurately. So many algorithms are developed over there where we can extract these blood vessels or simply highlight these blood vessels for the registration purpose, for the restoration purpose, for comparing purpose. Blood vessel segmentation related algorithms or blood vessel detection algorithms are developed in the literature. Okay, so this is also part of your um, pre-processing stage in detection of DR. So for detection of the lesion, it may be either microorganisms or hemorrhages or exudates. You must identify first the candidate lesion. So I'm talking about a typical machine learning algorithm where we follow these stages, right? So the such and candidate lessons are first extracted, and from these candidate lessons, you can see here these are the exudates and hemorrhages, and this is a microorganism. So we find and features for these extracted candidates, and we use these features for training of the classifier. So for training of the classifier, what is very important requirement for this medical images is annotation of the image is very important. So a proper annotation is required for training purpose. So image with ground truth will be required for training purpose. And we use a classifier basically for classification purpose. So typically in case of this DR detection, the disease can be detected at image level or at the lesion level. So image level is nothing but get an image and just classify that it is an DR image or non-DR image. So this image level classification is generally suggested, generally used for screening purpose. And lesson level classification is specifically used for detection of a particular lesson. To quantify that lesson, a lesson level classification is used. So if you're specifically looking for an early detection only, then you can go for lesson level detection. Or if you're going for an screening purpose where large number of people are there, and all these are the diabetic patients, and you want to just detect that a person is having or he's susceptible for a DR or not, there you can go for image level classification. So based on this, you have to select, or we have to select the features and the classifiers. So normally we use a number of classifiers available in the literature for the classification purpose, right? So just to show you some of the results, how it works, just take an example of early stage detection of DR in a retinal fundus image. So as I mentioned, early stage detection is very important because we can save the vision or loss of the vision for a diabetic patient. So, as suggested, every patient, every diabetic patient has to go through early stage detection of DR. So, the patient may be a normal patient or developing early stages of this DR. So, for that, a screening is a very important tool, very important method used by many clubs like the Rotary clubs or the eye vision clubs like that. So they go for a particular, they start an screening camp where all they call all the diabetic patients, and they screen for early detection of this DR. So very first symptom, very first lesson we can see, we can search for detection of early detection of DR is the microorganisms. So microorganisms has to be detected, or we have to look automatically for microorganisms. So microorganism detection is very important, or you can say you can go for simply red lesion detection. So red lesions are nothing but the microorganisms and hemorrhages. So automatic detection of this is very important for early stage detection of DR. Fine. So typically, again, if you go for a standard machine learning algorithm, we use this pre-processing, candidate region extraction. So I'll quickly go through this as the time permits. Feature selection and classification. So, say for example, in this case, I just shown the results and input image. We have enhanced this input image, and we applied certain algorithms. Here we are used here the algorithm for extraction of the blood vessel. So here the blood vessels are extracted from the original image using a linked component analysis and a match filter approach. There are many approaches available, but a linked component approach is what typically all the blood vessels are connected one, because they emerge, they start from this optic disc and they end. So there is no break as such in the blood vessel, because these are blood vessels. They emerge and end at the extremities of this eye. So, so you can search for your algorithm, a suitable algorithm, to get a proper, accurate blood extraction. So, what technique used here is we will just simply subtract the extracted blood vessels from the enhanced image or from this enhanced image. So once you extract, because microorganisms are not on the blood vessel, they are not appear on the blood vessel, they are detached, they are leak. So normally they are detached ones, so they are not on blood vessels. So we just remove these blood vessels from this connected component will with the enhanced image, and whatever remaining objects in the image, that are our candidate lessons. So you can see a lot of candidate lessons we can find. So it depends on the algorithm that you are applied. So out of that, for training purpose, we must know from this image where is the microorganism and what are its features. So feature extraction from this extracted candidate regions are done. This feature extraction with the appropriate label. So you can see here, this one, only 5 to 6 microorganisms and hemorrhages are there. So for that, we label that are red lessons, and for rest, we label as non-lessons. So these features, so you can use a number of features based on real algorithm. So typically, shape-based features, the color-based features, or gray level features, and some statistical features are used in general because they have typical size and the shape and the color as compared to other non-candidate lessons. So these features are selected and they are applied to the classifier for the training purpose, and then the same next image can be used for a testing purpose. Okay, so you can see here, so these are the detected microorganisms. Some false positives are there, maybe because of the dark lesions present over here. So true negatives means that there is no microorganisms or red lesions present, and the algorithm has not detected any such microorganisms. A false negative, you can see here, a very small faint blood vessel is there, but at the end it is a connected dark spot, but this is not an microorganism. So our algorithm has detected this falsely as an you can say, oh sorry, this is a false negative for a red lesion. The output of the algorithm you can show in this form. For this case study, we are used a database called as a direct database, direct DB database, which has the images along with the ground truth. So if you are able to see, you can see there are the two spots, very small spots are shown because these are the microorganisms, and the microorganisms are very small. So these are annotated the locations of the microorganisms present in the original image. So this one is the ground truth, and these are the detected microorganisms through our algorithm. So our algorithm has accurately detected the two microorganisms present in the original image. So we can say that compare it with the ground truth. Similarly, we tested this for the test images present in the database and compared with the ground truth. So there is this faint dot shown over here in the ground truth, which is also detected in the or in the output image of the algorithm. So true negative means this image doesn't have any red lessons present in this image. The same is detected as output of the image. So there are certain false positive also. So these are detected as the microorganisms or red lessons, but not shown in the ground truth. Here it is shown the lesson, but our algorithm has not detected. It may be because we restricted the red lessons to the microorganisms only. Because of that, it may be detected. So we have to train this properly, identify the features accordingly. So for comparing algorithms, normally we use the sensitivity, specificity, and accuracy algorithm parameters, which are based on identifying these factors, true, positive, true, negative, as you know, must be aware about that. So we tested this based on many such algorithms, combination of algorithms. This is just a very simple experiment, you can say, just to show you how you can proceed with. And there are many databases available with the annotation, with the ground truth, with the labels. So you can go ahead with this. There are many database also that can be used directly for the deep learning, for the artificial intelligence also, right? So I'll just share this. If you want, you can go through this afterwards, right? So what are the key areas that are still open in this, and that you can go for further research, or you can work on using this artificial intelligence or deep learning? So we all know what basically the deep learning is subset of machine learning, which is subset of artificial intelligence. So you must be aware about artificial intelligence is nothing but science of creating intelligent machines which are going to replicate the human behavior. And it is machine learning is a subset of AI where the software learns from the large volume of the data or the input that we're going to give by the trial and error without explicit instructions on how to derive the expected outcome or output. And the deep learning is nothing but a subset of machine learning which uses multiple layers of such neural networks, software defined neurons, to figure out the instructions on its own to process and get the appropriate output. So just to compare, just to show you, I'm not going in detail what the deep learning is, but yes, definitely the areas where you can work on this. So typical machine learning algorithm, as we had just discussed, we use this input image, some pre-processing, feature extraction, then classification, and based on that, we can go for referring the patient as he is DR or non-DR, or he is having some disease or non-disease. So in the deep learnings, all this is taken care by the models that one we use for the um, training and testing purpose. So still you can work on using the AI in retinal diseases at, as that is the detection and quantification of the features. Many few papers are there. Many few papers are there in these areas where you can definitely look into screening of retinal diseases, diagnosis and grading of retinal diseases, prediction and prognosis of retinal diseases, and a very challenging and very emerging area, AI in teleophthalmology. So, where you can apply this deep learning and AI is for automatic detection and quantification of these features is very important. The accurate quantification is very important. Accurate quantification of H's, the its size, the prediction of cup to optic disc ratio, right? So that is feature detection and quantification. So it is not only related to the fundus image, but you can also go for optical properties like then OCT images also. So the measuring the areas, the exact area of a particular lesson, exact area of the, say for example, nerve layer, the volumes, the blood fluid, its pressure, its damage, proper quantification can be done using the AI. You can use this AI for the screening purpose. The main difference between the screening and the other technique is that here the population is large for the input, and out of that, the intention is just to segregate or just to classify whether it is an having this diabetic retinopathy or non-diabetic retinopathy. Similarly, you can go for screening of AMD also. You can go for screening of glaucoma, or this is also a very challenging domain called as a retinopathy of prematurity screening. So many newborn babies are facing such and problems related to immature or proper development, improper development of the blood vessels. So that leads to the permanent loss of the vision. So for that, a test for that particular condition is referred as an retinopathy of prematurity. So you can screen that. So whenever there is a baby, screen for that. Okay. Or screening of retinal disease in general. So in general means what? Just to develop an AI algorithm in such a way that Just give an input image, eye image, it will detect what type of disease this image has. Although it looks like an very challenging or very great task, but yes, definitely there is a scope for this detecting disease in general. Okay, so diagnostic grading is as an very important for a particular disease. Grading is nothing but you have to just grade the disease, whether it is a non DR or DR, and if it is a DR, then what is the stage. So in medical field, there are the stages of the DR, like in certain areas they called as 0, 1, 2, 3, or in certain areas doctors refer this as the mild, moderate, or severe DR. So like that, you can go for use of AI in grading of DR, grading of AMD, or grading of glaucoma, or prematurity of the retinopathy, or systemic. This is a very challenging and very interesting application of AI. You can say diagnostic and grading of systemic diseases using the retina or it's using the eye. So typically, systematic disease is related to your hypotension, blood pressure. So all these diseases can also be detected using eye or using retina images. So you can apply this appropriate AI for grading of systematic disease also. Prediction and prognosis. So the prediction of a particular and prognosis of that is a very challenging domain, you can say. We can go for with this uh, AI. As I mentioned, teleophthalmology is very challenging and emerging technology, as you can see, due to this pandemic situation. Also, visiting of the patients to the hospitals is not referred or preferred. So there we can work or we can go for teleophthalmology. Another reason to go for teleophthalmology is that number of patients is very large as compared to the number of doctors, number of experts present, and that too in rural areas. The experts are not available, or the experts are in such urban areas. So the immediate solution for that, which is already going or which is already using by many eye care hospitals, is teleophthalmology. So traditional teleophthalmology, which is used by many vision hospitals, are using such an dedicated van, which consists of all the equipments to screen the eye and all these eye images. So because doctors don't go along with that van, but such certain uh, technicians are going to capture these images, and the images are sent to the base hospital, where doctors are going to analyze these images, and then they are sending the report or analysis back to the campsite. So you can see this one is the campsite and this is the base hospital where doctor sits. So this gives an immediate solution where there is an need of the experts, but it needs a dedicated van. They need to carry such an huge cameras, which are very costlier cameras. The availability of the doctor must be there in the hospital. So all these are some of the limitations, we can say, of the traditional ophthalmology. So currently, a lot of research is going on the development of handheld fundus camera. So yes, definitely it is going to uh, resolution may be less, but it is an handy handheld we can carry anywhere. The cost of this may be very less, and we have to think on this how we can integrate this for a teleophthalmology purpose. You can come up with use of this AI for development of an applications for smartphone based applications, smartphone based screening, smartphone based detection of the disease. So for that, very first thing is development of such an camera, and then development of such an processing model, or you can say the web based or as an application based. So, what is the need of the current teleophthalmology is it should be smart enough so you can use the images in smart way to access that, to process that, to send that, to store that in the cloud, or the cloud processing you can use over here. It should be portable, simple, and all the data that is received, starting from the patient data to the data related to the eye, it should be properly analyzed using data analytics tools. So these are some of the you can say open domains available for teleophthalmology, right? So these are some of the, I just put up the domains that are available for further research. That's all from my side. I try to complete before the time. So at the end, I try to uh, wind up some of the slides. Right. Yes, madam.
Thank you, sir. Hello.
Yes, yes, madam.
Yes, sir. So there are a few questions. The very first question is how to achieve 100% accuracy in medical treatment, and does AI gives highest accuracy without human intervention?
Yes, definitely. Very good question, madam. 100% accuracy is the target for all the engineers. And only the target is not 100%, but we have to just help the doctors. And definitely a lot of research is going in AI field to give and better accuracy as compared to the traditional machine learning algorithms. So a lot of AI models like the TensorFlow or Keras are being used in this ophthalmology field. If you search for in the literature, very few papers are there, but they have not yet achieved a good accuracy. So because of that, I just said that it's an open domain for to work in using this AI. Yes, definitely AI will help, as it is helping in many other domains. It will also show its wonders in this domain, also in medical field also.
Yes. So the next question is, in what all the various web resources which will provide the database related to eye diseases, because there are different diseases.
Yeah,
So,
yes, yes.
and how
So
many images in one database actually is required for the experimentation?
if you go for traditional machine learning algorithms, a few images are sufficient, but for deep learning for AI, you need as maximum as images. Only limitation to use this AI in ophthalmology related applications or diseases is a lot of images are not available in the database. But I mentioned here few databases. Definitely these databases are there. In one of the database, they have more than 4,000 images, which are sufficient to begin with using AI. But there is no such standard rule for that, how much images you need for training and for the testing. If you have a less number of images, then you can go for various other cross validation methods or combination of the images. Right. So these are some of the databases available. Out of that, this Kaggle DR data detection is having a huge amount of data, huge amount of images with the ground truth. This HEIMED is also having more than 4,000 images, which are sufficient to begin the work for
Yes.
detection of the diseases.
Yes. So the next question is, as you have told, for early detection of micronism
Yes.
is to be detected in which stage of the diabetes micronisms can be detected.
Stage of the diabetes. See, every person is susceptible for DR. So it depends on if you have the diabetes. If you detect this DR at the early stage, then you can cure that. But if you are asking for at which stage of diabetes the DR starts, it depends on person to person. There is no standard rule for that. So because of that, a person having diabetes, they have to follow or they have to go for a routine checkup. So
Yes, sir.
current cases are there. 20-year age kids are also having this DR. So why it is called as DR? Because it mostly because of the elevated blood sugar levels. And as you must be aware that now the diabetes is not related to age factor. It because of the lifestyle, because of the eating habits, it is going to happen for most of the all age. There is no rule for at which stage of the diabetes DR initiates. So as soon as you detect the diabetes, go for the DR test.
Yes. Thank you, sir. We are now at the end of the session. I would like to take this opportunity. Good morning, everyone. I, Dr. Swati Visikar, take this privilege to propose vote of thanks for today's chief speaker of the session, Dr. Vijay Mane, sir, for conducting session on AI in ophthalmology. Sir, you have given very informative session, various technical details you have covered, what all the eye diseases, diagnosis related image processing and all. Thank you, sir. This will definitely help the researchers to work in this field. You have also explored the retinal research areas and the AI and ML applications that is related to this field. Thank you, sir. Thank you very much for your words of wisdom. Thanks a lot.
Yes, madam, I take this opportunity to thank respected RK sir, our respected head of department Jadhav sir, Patil madam, and you Bisekar madam, Sonone madam as a coordinator, my friend Paitan sir, for giving me an opportunity to share my views to connect with the participants. Thank you very much.
Thank you, sir. Yes.
Yes, yes. May I leave, madam?
Yes, sir. Uh, Hello, participants are requested to stay over here. The next speaker, like Karandikar sir, is joining soon. Okay. The session will start sharp at 11:45. So you be here only.
Ma'am, you're audible.
Yes. Uh,
Yeah, can you hear?
Karandikar sir, good morning.
Good morning.
Yes. Kulkarni madam, we can start now.
Okay, ma'am. Good morning, sir. So, I, Mrs. Vaishali Kulkarni, take this as a great privilege to welcome distinguished personality as our today's speaker, Dr. Shrirang Karandikar, sir. I take this opportunity to introduce our today's speaker. Sir is the founder of Algo Asylum. Sir has served in many companies. To name a few, Velocity Incorporated, as he has worked as Chief Technology Officer, Shell India Market Private Limited as General Manager Computational Technology, Computational Research Labs as Distinguished Scientist Group Head, in Technology Innovation, IBM Austin Research Labs as Research Staff Member, Intel Corporation as component design and design engineer and senior sales engineer at NIIT Limited. Sir has pursued his Doctor of Philosophy in Electrical Engineering in Synthesis and Performance Prediction of VLSI Designs from University of Minnesota in 2004 and Masters of Science in Electrical Engineering in CAD algorithm for VLSI physical design in 1996. Sir has his publication in many papers in international level, and Sir has delivered many various invited talks also. So we welcome you, sir. So may I now request Dr. Karandikar, sir, to take over the session. Over to you, sir. Hello, sir.
Okay. Can you hear me?
Yes, sir.
Okay. Yeah, sorry about that. I was on mute. So let me repeat myself. So good morning, everyone, and a very warm welcome to this session. I hope this is going to be a different session from the ones that you have seen so far and what you will be attending in the rest of the, the program. In that, I don't have any slides. I have a Jupyter notebook. I have a bunch of code, and I'm just going to be walking through it, right? What I do hope to do is just walk you through a little bit of experimentation with different models that are available in scikit-learn. So this is going to be based on Python, by the way, in case you hadn't figured out. And we're going to be looking at a couple of libraries at Python. We're going to be looking at some of the models that are available in those libraries and how we could use these for different kinds of classification problems from the biomedical domain. So that's going to be the plan for today. And I'm just going to be walking you through this code. I'll describe some of it in, I think, a relatively superficial amount of detail, given the amount of time that we have. But my request to everyone is, if you feel that we are going too slow, and I'm going into too much depth and it's too basic, just put a message in the chat window. I'll switch gears. Or conversely, if you think that I'm going too fast, put that in the chat window as well, and I'll slow down. Of course, if you think the speed is just right, the pace is just right, let me know as well. All feedback is appreciated. I've given this talk at a number of other forums as well. And one of the things that I was consistently asked is, okay, we want to do something in the biomedical engineering domain. We want to look at how AI can be applied out here, or what kinds of things are being done. But where do we get the data from, right? Now, so before I get started with the actual software, I want to start out with just showing you a couple of websites, which I think are fantastic repositories for data, whether you're in the the first is specifically for biomedical engineering, and the second is more general, right? So I'm going to start with sharing my screen. And I guess I'm going to turn off my video to keep things sane. Okay, so is my screen visible? Or if it's not, please speak up. And if yes, then I'm going to go ahead with what I want to show out here. So the first the first website I wanted to talk about was Kaggle. And in case you guys haven't heard of it, you should run to look at this website and see what kinds of stuff is available out there. This is a brilliant website for all kinds of, please increase the font, okay. Thank you for that. I hope this is better. So this is a brilliant website when you want to look not just for data sets, but also if you want to look at different kinds of competitions, if you want to use this as a platform for learning, and if you want to look at how other people are approaching the same problem from multiple different perspectives. So when I log into Kaggle, this is what I see. There's a news feed with a whole bunch of things out here. I'm sure there's a reason for the articles out here, but I don't know what the logic out there is. But out here, for example, you see there's something on pneumonia detection, and somebody's posted a few pictures. There's HubMap is not biomedical engineering, but pneumonia detection was quite. Oh, there we go. There's another one, brain tumor classification. So this is again something that is related to the subject that we are studying in this FTP. But this is, of course, in my news feed. But if you look at this menu on the side, you'll see a couple of very interesting items out here. I just wanted to quickly show you this compete tab. You can form a team or even individually participate in different competitions. Some of them have a pretty hefty price. This read prediction problem, for example, has a price of 100,000 US dollars. So if anyone's looking for a side hustle, this might be just your ticket. But more than the prize, the interesting thing is, and I'm just going to show this to you because it's pretty interesting. There is a leaderboard, and you can see currently there's a team called Mamas who's got a score of 80.5%, and they've been pretty active. They've had 39 updates so far, and this doesn't. I mean, the top 10 teams are between 0.795 and 0.805, so they're going pretty neck and neck, right? So you can join in these kinds of competitions if you want to, but more interesting is this tab called Data, where you have a whole bunch of different data sets. And in fact, I could go ahead and you can see my history: Alzheimer's, malaria, biomedical. I really like this malaria data set, and I hope I can find it. There we go, the cell images data set. So this one has a whole bunch of, and just to see the kinds of stuff that you have out here, that's 675 megabytes of data, 27,000 images, and let's see. And each image is an individual image of one cell that has either been infected or not infected. And people usually use this as a proving ground for image recognition and classification to see whether you can actually detect whether a cell has been infected or not by training either a neural network or other kinds of data, right? So this is, and then there's, you've seen the stuff that I was searching for. There's malaria, Alzheimer's, and a whole bunch of other stuff. The other interesting thing that I wanted to show you, I think if I look at MRI, maybe. There you go. Let's look at I don't know. I'm just randomly choosing one of these. What I wanted to show you is there will be, so along with the data, people upload the work that they've done as well. Now, this is pretty old, but you can still go in and look at what this person has done in terms of analyzing the data that was there. Okay, this is stupid. Sorry, this is just a, okay, let's look at this one. So this person has actually uploaded this data set, and you have all the data. They've not done a very good job of commenting about what they're doing. Okay, there we go. So this is information that the author has added to describe what he's doing, right? And then he'll walk you through different experiments. He'll walk you through why he's doing what they're doing. And then they'll go in and say, okay, here's how you can load the data, and this is how you can visualize it. So not only is this a fantastic repository for the data, it's also a fantastic repository for getting ideas about learning from what other people have done, getting ideas about what we can do as well, right? So I'll let you guys go ahead and explore Kaggle and the notebooks and so on. The other website, now Kaggle, as you can see, has competitions on all kinds of things, right? There was this, or even their data sets are segmented into like a whole bunch of different areas. Biomedicine is just one of them. They also do a lot of stuff with financial information, US elections 2020, presidential debates, top 50 best-selling books. I have no idea what Indian food 101 is. Data about 255 traditional and famous dishes in India. I'm not sure what machine learning models we'll build from this, but hey, it's there, right? So anyway, so that was Kaggle, and what I'm going to be doing today is based on a data set from Kaggle, which I'll show you in a second. The other website that is very, very useful that you guys have to look at is this thing called PhysioNet. Now, as you can imagine, this has a whole bunch of data around basically biomedical signals. And you can go in and browse around out here to just look at it. If you go to data, you'll see the actual databases. There's of course Mimic, which I've been working with a collaborator from New York. There's all of these databases that you can go in and download. Some of them, most of them are open access, so you can just go ahead and download them. Some of them are access controlled. So in some cases, you've got to do a small course in order to get access to that data. In other cases, there'll be some confidentiality concerns, and you've got to sign away your firstborn in order to get access to it. I joke, of course, but you'll have to look at depending on what your interests are. The thing I didn't like very much about it is, at least at a superficial level, the databases are organized alphabetically, which, it would seem that organizing them according to the signals that are captured or the condition that they are evaluating would have been a better form of classification. But anyway, similar to Kaggle, these guys also host competitions, and I don't know if I'll be able to, there we go, challenges. But these are not necessarily for money. These are challenges that are, they're mainly academic competitions, and the results are presented at different conferences. That's what you'll see out here. And the winning submissions can go ahead and publish their results as part of the proceedings as well, right? So if you're looking at it more from a pure research perspective and you're looking at a place to present your stuff, this could also be something that you can look at. There's a question out here, how annotation files can be extracted from PhysioNet, especially .hyp extension files. I must confess, I have no idea how to do that. I've not played around with HYP myself. I've used, I think, the Dymax for image formats, but I haven't used HYP, so I'm afraid I won't be able to help you out here. But I dare say, if you look at the forums, or if you look in, there's tutorials out here, most likely you will find something on how to go ahead and extract data from these files. All right. So, so just wanted to share both of these resources with you guys. Both of them are amazing resources, a whole bunch of data. And not only that, if you're looking for how to focus your research or what the rest of the world is looking at, this could be the right thing to start out with. Okay, so my goal today is to look at how I could add value to your faculty development program. And one of the things that I realized is that most people, typically in India, in academia, and things are changing now, but traditionally people have been very used to using MATLAB, right? But the de facto standard these days is now Python, simply because of the number of libraries and tools that are available with Python. So it doesn't make sense to do like a Python tutorial because you guys have already done a lot of MATLAB programming, you're comfortable with it. So that's not, there's no really need to get into talking about what Python is and how it's structured. The second thing is Python is pretty easy to learn, right? And as you'll see, I'll walk you through the code that I've written out here. You'll get it immediately. You'll understand what we are doing, right? What's more interesting is to see how Python can be used in the context of biomedical engineering, right? So what I'll be doing is we'll be looking at a particular data set. This is ECG heartbeat categorization, which I downloaded from Kaggle. There we go. It's one of these. It might be this one. Yeah, it's this one. So this is the data set that I've downloaded, and we're just going to go in and play around with it to see what we can do. The problem with this data set is when I apply a very standard classification algorithm to this, it gives us very good results. So the results are not going to be something that we can try to improve because they're already very good. But I think that's fine. I mean, it gives us a very good a sense of the capabilities of what we can do with Python with the libraries that are available. I'll, hopefully this will give you a good overview of the kinds of things that are possible. This is of course for ECG heartbeats, but you can, this is what I want to really focus on. Okay, so I'm going to start off with just a quick overview. I'm hoping you guys are familiar with this particular environment. It's a Jupyter notebook, and it's a fantastic environment for running Python as well as R, as well as Julia programs, and a bunch of others as well. And I think if you're used to MATLAB, you're probably familiar with this overall environment. I have a whole bunch of cells which can either be Python code, or they can be, this is essentially something called Markdown. So if I were to edit it, I use a little bit of syntactic sugar that gets interpreted as HTML and then rendered out here so that it looks like this. So this notebook has the link to the actual data set. Once you, yes, and to answer the comment, I will share the code. I'll share the notebook with the organizers right after this session. Okay, so I'm going to start out with just executing the first few cells. This is basically the matplotlib inline. Okay, let me take a step back. So 3 libraries that you guys should get very comfortable with when you're working with Python, no matter what domain you're working in. And these are very fundamental libraries. So one is NumPy, which stands for numerical Python. The second is matplotlib, which is a library for plotting data the way you would in MATLAB, right? Hence the name matplotlib. And the third is a library called pandas, which actually stands for panel data. So these 3 libraries are almost like foundational. No matter what you're going to be doing in Python, you will probably end up using these 3 libraries in some form or the other. So if you are planning to get into Python, the first thing I would highly recommend is developing a very good capability understanding of the library and what is possible with these. Finally, what I'm going to be using extensively in this notebook is this library called scikit-learn. As with most things in Python, you can just search for example, scikit-learn, and that's the website for scikit-learn, and you can see they have a whole bunch of different uh, uh, AI techniques pre-implemented. So there's classification, regression, clustering, dimensionality reduction, model selection, processing, and so on. The nice thing about scikit-learn is all of these algorithms follow a very similar, what should I call it? A very similar interface that you'll see as we go ahead. But coming back to the code, I don't want to import like the whole thing, but these are the ones that we are going to be using today, and you'll see how we use those. I was trying to do some stuff with FFT, but I wasn't able to get that to work, so we're not going to be doing that. Okay, now what I have already done is I've downloaded this data set as a CSV file. CSV file is comma separated values. You can load it up into Excel if you want to. In my case, I want to load it up in what's called a data frame. So PD is an alias for pandas. So I said import pandas as PD. And then I'm calling this function pd.readcsv, and I'm giving it the path to this file. So out here, the data has been provided to us in 2 forms, in 2 files. One is the heartbeat data related to a normal heartbeat, and the second is an abnormal heartbeat. So it's already been classified and labeled and segregated into 2 different files. And I'm just reading it into a data frame called dfn and dfa. If you want to find out what the type of a particular object in Python, you can just say type df_n, and lo and behold, it says this is a pandas data frame. Okay. If you're any time you're wondering what you can do with a data frame, now Python is an object-oriented language to the extent that everything is an object, even functions, lambdas, or even any variable that you have, even integers, characters, these are objects. And objects have a bunch of functionality, which you can query using this function called dir. If I say dir on this data frame, it gives me a whole bunch of different things that goes on and on and on and on and on, right? So I just wanted to show this to you because if you're wondering, I know we can do this with a data frame, but I'm not sure what it's called. Just say dir and that variable name and you'll get that. One thing I must caution you is in Python, not every, but most objects also have these functions and attributes that are preceded and followed by 2 underscores. So this is called a dunder variable, double underscore variable. And the intent is you don't call these directly. They are there for reasons of engineering. If you inherit from the class, you might have need for implementing these or calling these. But otherwise, in general, you should not be mucking around with these dunder attributes. You should be looking at these. So you can do an abs, add prefix, add suffix, aggregate, and so on. Okay, so that's what you get when you do a dir df. But that doesn't tell me what has been read into the CSV. So in order to do that, I can just say dfn.head, and the 5 out there is just saying, show me the first 5 rows of that particular data set. So what I get out here is the following, right? The first column is an index number. So it's a row number, 0, 1, 2, 3, 4. The next columns are the actual data. And out here, this looks really odd. The column heading is also a numeric value, right? So basically what happened was when we did the read CSV, the assumption was the first row in the file would be the title of the column. But in this case, it turned out to be not the case. So we'll fix that. But okay, good. We've kind of printed out the first 5 rows, and this goes on and on and on and on all the way till the end. But I don't really know what has been read. So if I say dfn.shape, this gives me that this particular data frame, dfn, has 4045 rows and 188 columns, right? So I could also go in and change that to dfa. So that's the abnormal. And that has 10,000 rows and thankfully 188 columns. So the number of columns in both the data frames is same, which is what you'd expect. And we have 4,000 rows of normal data, 10,000 rows of abnormal data. Okay. So I'm going to go ahead, but I wanted to take a quick pause out here. I'd really appreciate it if people were to just comment on whether I'm going too slow or too fast or just right. Okay. And I'll adjust my speed accordingly. Okay. While you guys are doing that, I'm going to quickly fix this part by saying, repeating the read CSV command and saying header is equal to null. So this is basically saying that the first line in the file itself is the data, is part of the data that we wanted. Okay. So mostly everyone's saying that, not mostly, everyone's saying is the space is right. So thank you. And we'll continue with that, but please comment as needed. Okay, so I'm going to read these files again. And now if I say, show me the header or show me the first 3 lines. So here are the rows. And now the column headings go from 0, 1, 2, 3 all the way to 187. It's 0 index, 188 columns, and how many ever rows. Okay, and the shape of course won't change, right? Because it's going to be what it was before. Okay, so now we say, okay, this data is difficult to look at, right? I mean, there's 1, 0.9, 0.3, 0.05, and then a bunch of zeros at the end. How can we visualize this data? And I'm a big fan of anytime there is data, I try to visualize it because we get to understand a lot more by visualizing it, right? So as a brief digression, let's just look and see what it, let's just plot it and see what it looks like. Now, this is something, if you're familiar with MATLAB, you'll understand this immediately, right? I just took a row of data. I randomly chose 500 out here and I plotted it. And for these 187 indices, these are the values that we get. Right? Okay, great. So that's what, and let's see, I took it from A. So this is abnormal. I could just have well had said N, and that's what a normal data looks like. And I know with heartbeat, you have the whatever uh, P, Q, M, N parts of the heartbeat. I remember reading about it, but I've forgotten what it is right now. Okay. But now suppose I want to, right now I changed A to N and I plotted it, but suppose I want to look at a few different uh, abnormal and normal plots on the same screen at the same time. This is pretty straightforward. I'm going to define a grid of 2 rows and 5 columns. In the first row, I'm going to plot normal data. In the second row, I'm going to plot data from the abnormal data frame. And I've just randomly picked up, for the index, I've just randomly picked up a couple of different indices. So what we get out here is normal data, and this is abnormal data. And sure, if you look at it visually, it does look like, the normal data seems to follow a similar pattern, whereas the abnormal data doesn't, right? So this is a kind of a sanity check that the normal, abnormal match our expectations, but also we've probably done the right thing, right? So this is just a little bit of, it's not quite exploratory data analysis, EDA, but it's fooling around, getting a feel for the data, understanding what's out there. Okay, so now let's think about how, what we want to do and how we want to represent the data. Right now, the data was given to us in 2 comma separated value files. What we've done is we've read those files into 2 separate data frames. But what we want to set up is we want to be able to run a classification experiment on this data. So of course, we don't want the data to be 2 separate data frames, right? We want to mix them together. And we want to label them. So rather than them being in a separate data frame according to whether they're normal or abnormal, we want to have a label that says this is abnormal and this is normal. So what we're going to do is I want to add an extra column to the data. And that column is going to have a title called N. And for all the rows in my normal data frame, the value is going to be 1. For all my columns in my abnormal data frame, the value is going to be 0. So if I do this and I run it, for the normal, I have this additional column called N111, right? If I look at the shape, right? Previously, the DFN and DFA, if you remember, was 188 columns. Now it's 189 columns because of this additional one. Of course, if I were to print, DF A.head, this N column would have zeros. Okay. And now what I want to do is I want to smoosh these two together. I want to create a single data frame with all of that data. Right. And then we'll look at, I'm going to store it in this data frame called DF. And let's just look at what it is. Right. So when I do this, I get a single data frame of 189 columns of features as we had before, and 14,552 rows, which makes sense. There were about 10,500 abnormal rows and 4,000 normal rows. So you add them up, you get 14,552. When I print the data frame, it goes, 0 to 6, 7, 8, 9, all the way to 187. Those are the columns. The rows, however, look really odd because it goes 0, 1, 2, 4 up to 10,505, right? But if I look at the dimensions, it says 14,552, right? So what's happened out here is that it's taken these indices and it's concatenated those as well, right? So now if I repeat the concat command with this ignore index equal to true, what we get is It's the same 14,452 into 189, but the row numbers now go from 0, 1 to 4 up to 14,551. All right. Okay. Now, the second thing that I'm going to do out here is I want to split the data into a training set and a test set. And this is where a library like scikit-learn is extremely useful, because I have this function called train test split. And I'm going to walk you through the arguments to the function so you see what it's doing. So the first thing I want to draw your attention to is this argument. It says shuffle is equal to true. So what it's going to do is, right now, if you remember, we have 4,000 normal data followed by 10,000 abnormal data. So even out here, if you look at these column, the n column, right, there's a whole bunch of ones followed by a whole bunch of zeros, right? So when I say shuffle is equal to true, it's going to randomly pick rows from this, right? It's not going to pick the first set of rows or the last set of rows. Okay. The second thing is I'm setting test size equal to 0.2. So what I'm saying is I want to split this data so that 20% of my data is the test set, 80% is my training set. And then I'm saying random state is equal to 2. So this is just a seed for the random number generator, so that if I run this again, I can get a repeatable value. Finally, these two arguments, right? This is the data that I'm interested in. This is the label of that corresponding data. Okay. So if you remember out here, this goes to 189 columns. The first 188 of those columns are actual features of the data that I'm interested in. The last one is the label, right? And what this is going to return is 4 vectors, and we look at what these vectors are. But it's going to have a whole, the trained data is going to be 80% of this. The trained labels are going to be the corresponding 80% of this. And similarly, test data and test labels, right? This syntax, I hope, is familiar for anyone who's used MATLAB. This is a 2-dimensional array, right? 14,552 by 189. So it's saying use all the rows, 14,552, but only columns up to 188. Don't use the last column, right? So now if I look at, let me run this first. And by the way, so the reason why I did this was because I wanted to make sure I had the right shape of the data when I was building this up. Okay, so now if I do this train test data and then I look at what I have. So my training data is 11,000 rows, 188 columns, and the labels are just 11,641 rows. And similarly, the test data. All right. Okay, a question out here is how concat the rows equal to 14,552. Oh, that's because if you look at the two, where do we have this? Yeah, if we look at, let me just do this print. Right. If I look at the data that we've collected, it's basically 10,500 abnormal and 4,046 normal rows. You add the two of them up, you'll get, let's see, 14,552. All right. So thanks for the question, and I hope this clarifies. Okay. So moving ahead. So this is basically now out here. This was all abnormal data. This was all the normal data. After doing this train test split with shuffle equal to true, we've mixed all of them up, right? These 11,000 are a mixture of normal and abnormal data. And similarly, these 2,900. Okay. Now, the first classifier that we're going to use is the nearest neighbor classifier, right? If you guys are, I'm going to give you a very brief overview. If you want a detailed description, just type a message in the chat window and we'll do it at the end. So what does a k-nearest neighbor classifier do? Basically, it's going to take a particular test set. Kindly explain line number 17, 18, and 19. Oh, so no, so this is okay. So, okay, let me try to do this really quickly. So, what this is doing is it's taking the data set DFN, which had, if you remember, 4,046 rows and 189 columns, right? And it's concatenating the data set DFA beneath it, which has 10,506. So overall, I'm going to get a data frame of size 14,452 rows and 189 columns. That's all that we're doing, right? And all I wanted to emphasize is in order to get these index numbers correctly, I said ignore index equal to true. So that instead of ending at 10,505, which was the last index of DFA, it now ends in 14,551, which is the last index of DF. That's all that I wanted to highlight. Right? Okay, but there is a lot more. Don't worry too much about this stuff. Okay, so what I was saying was what we're going to do is suppose I pick a test from the test set. I'm going to calculate the Euclidean distance of that to all of these other 11,000 data points, right? And what do I mean by Euclidean distance? I'm going to view these 188 values as 188 dimensional space. And I'm going to say one particular test is defined by its location in this 188 dimensional space. The exact location is given by the values of each of these dimensions. And then I can calculate the distance between this point and every other point. I can see which one is the closest to the data that I'm looking at. And then I'm going to say, okay, I'm going to pick its label as my label. So I am going to say whether I am abnormal or normal based on, if I look at all the data that is close to me, which one is the closest. Now, looking at just one may or may not be the right thing to do. So we have the ability of defining k nearest neighbors. So for example, we could define k to be 3 or 5. And we could say, look at the 5 nearest neighbors and then choose the majority of those 5 as the label that I'm going to represent. Okay. Now, similar to what we did before with the dir command, I can also give a particular name of a package with a question mark. And if I run this, it gives me the documentation for that package. Right. So for example, it says this is a classifier implementing k nearest neighbors, right? And then here are all the parameters that I can give it, right? Now, we're not going, and it's got a few examples as well. Okay, so what I'm going to do right now, and if you remember, I was saying the nice thing about scikit-learn is that it follows the same interface, right? So what we're going to do out here is, and I'm going to tell you what this interface is. It's dead simple. Step 1 is instantiate an object. Step 2 is fit. Step 3 is predict. And step 4 is score. That's it. Okay. And this remains the same even as you try different kinds of classifiers, as you'll see in a second. So out here, we are doing steps 1 and 2, creating an object and fitting the data to it. Okay. And I called it with all default parameters. So all of the stuff that you saw in the documentation up above, it says algorithm is auto, leaf size is 30, metric is Minkowski, number of neighbors is 5. This is the most important thing. Weights are uniform. That's usually the best thing to do. Okay. Now I've called fit with the train data and the train labels. Now I'm simply going to call predict on the test data. Right? And this takes a bit of time to run because for every test data, it's calculating distances to all the 11,000 training data. Okay. But the return value of this is being stored in this variable called P. And if I just do this, P is of length 2900, so it's the same as the test data. And if I randomly print 5 points, it's, it's a mixture of zeros and ones, right? Which makes sense because we can either predict a particular test case is normal or abnormal, which we've encoded as a 1 or a 0. Okay. How do we know how good or bad this is? I'm going to show you two ways of doing it. One is the Python way, and that's just for fun. But the better is to use the scikit-learn way. Okay. So test labels is also a vector of zeros and ones. So if I just do P minus test labels, this is going to be a vector subtraction and store that in diffs. Diffs is also going to be an array of length 2911, right? And now here's what I can do. I can call a function called value counts, which says that there are 2908 zeros in diffs. -1 occurs 2 times and 1 occurs 1 time. What do these numbers mean? Diffs is storing a prediction of 1 or 0. Test labels has the actual value of 1 and 0. So if I take their difference, and if they are equal, I'm going to get a 0. So this shows that, I've just mispredicted 3 points. 2,908 points of them are predicted correctly, right? So now we've seen create an object, call the fit method and call the predict method. And finally, the fourth one was you can either calculate the error like this, or I can call something called accuracy score, which is basically going to be 2908 divided by 2911 or 99.89%. Okay. There are also a few other helper functions, like I can draw a confusion matrix about the zeros that were predicted correctly, the ones that were predicted correctly, the ones that were predicted as zeros, and the zeros that were predicted as ones. All right. Okay. Now, here's where we can start jumping in and trying out a little bit of variation on on the parameters that we had. So the first thing I'm going to do is, instead of the default value of 5, suppose I want to try out different values of n neighbors. So what I could do is I can define a list 1, 2, 5, 10, 15. And then in a loop, I can just say I can create a classifier with n neighbors equal to n. So now again, create an object, fit, predict, and calculate the accuracy. 4 things you need to know in order to use pretty much all, or not all, most of sklearn. If I run this, and again, it's going to take some time. Let's get at least a few. Anyway, let it run. The other thing I could also try, there we go. So for n equal to 1, we have 99.9% accuracy. So that's even better than the 99.89. Oh no, it's better than the 99.89 we were getting out here. Anyway, the other thing I could, and this is just me trying to experiment with the variations just so that we can do something interesting with this. So what I could say is, instead of calling fit on the entire training data, suppose I give it only 10% of the data or 20% of the data, then how does the accuracy change, right? So out here, what I did was I divided the range 0.1 to 10, 0.1 into 1 into 10. Okay, it's going to run after this finishes. Okay, into 10 slots. And then I say for each of these slots, right, create an object. I'm calling fit only on train data up to IDX. 0.1, 0.2, 0.3, 0.4, all the way to 1, right? Create an object, fit, predict, accuracy. Out here, this is, I'll just start this off. Out here, this is done 99.9397. So n equal to 2 did pretty well. 907962. So in fact, n equal to 2 is the best outcome that we can have, right? Out here, if instead of 11,000, if I have 1100, my accuracy is 98%. And then as it goes to 2,000, 3,000, 4,000, the accuracy steadily increases, right? Not very impressive when your basic accuracy itself is 98%. But the goal was to get you guys a sense of what's going on out here. All right. Everything okay so far? And if so, or if not so, either way, just post a message. And I want to start talking about dimensionality reduction. Okay. I'm assuming that you guys are familiar with dimensionality reduction. The basic approach is to do principal component analysis. There are other ways as well. But I'm going to show you how you can do this in sklearn and how literally easy it is in order to do so, right? So I basically take this data frame, I drop that n column that was there, and I just, now again, create an object, fit, predict, and evaluate, right? So out here, I create an object and I say I want the first 5 dimensions. The original data had 188 dimensions, right? I want to reduce that to 5. So create the object, fit, and now instead of predict, I say transform. What is transform going to do? It's going to take this data frame and it's going to return a data frame that should have 5 columns instead of the original 188. So if I print the shape, sorry, I guess I should run this first. So we went from 14,552 188 columns to 14,552. The number of rows, of course, doesn't change, and this goes to 5. How well did we do? I can print out the explained variation ratio. So for each of these dimensions, how much of the variance is captured by each dimension. And if I add all of them up, how much of the total variance are we explaining? So if I do this, I get 1, 2, 3, 4, 5, going from 37, 12, 6, 4, and 3.5%. I add all of them up, I get 64.94. And I could just as well take 15 out here if I wanted to. And I would get 15 dimensions and I would be explaining 82% of the variance, right? So applying principal component analysis, dead simple, right? Once I have this reduced data, I also thought, let's see what would happen if I try to visualize this data. I can't, of course, visualize the 188 or even the 15 or the 5-dimensional data, but maybe let's just do a scatter plot of data frame 0 and 1, right? Of column 0 and 1, which respectively account for 37.6 and 12.5% of the variance. So now, again, if you're familiar with MATLAB, this should not come as a surprise. plt.scatter, so create a scatter plot with the first column and the second column. The rest of it is just syntax. Use the labels column to determine whether it's a 0 or a 1, and color the 0 is gray, and so this CLRS is given out here, and the 1 is a green, right? The alpha is just a transparency factor. So when I run this, we get something that looks like this. And this looks really horrible. I mean, how are you ever going to disambiguate or even do a nearest neighbor between these two? But keep in mind, this is actually 188 dimension data that's been projected to 2 dimensions, right? In 2 dimensions, we are only capturing 50% of the variance. 5 dimensions was 60% and 15 was 81%. And remember, we are actually going to be doing k nearest neighbors in a 15-dimensional space, not in a 2-dimensional space, right? Okay. I could, instead of plotting it like this, I could create 2 different plots, right? Of the normal and abnormal heartbeats, okay? Again, this is just more as a demo to show what you can do in Python and literally how easy it is, all right? Okay, so now, I can go ahead and, yeah, I think I was just fooling around with this to make sure we had the right data that we wanted to use. Now I'm going to split DF reduced into the train and the test data. And when I print it out, if you remember, I did this with 15, with a PCA of 15. So the data is 15 dimensions. The labels are, of course, just a single dimension. And now I can do a k nearest neighbor on this. Again, remember the mantra: fit, instantiate an object, fit, predict, and determine the accuracy. So this is the first two steps. I call predict, and then I print the accuracy according to my metric, where this is funny. So instead of 188 dimensions, if I take it down to um, uh, 15 dimensions, the accuracy increases, to a ridiculous amount, 99.96%. Okay, suppose I want to do this for a number of different dimensions, right? Again, just put it into a loop, do the PCA, fit, transform, split, create an object of k nearest neighbors, fit, predict, and print the accuracy, right? So simple code, easy to understand, nothing very complicated. I can run this and say, okay, 128 dimensions explain 99.81% of the variance. Accuracy is 99.76, and so on and so forth. Of course, with NM equal to 2, we are explaining only 50% of the variance. Accuracy is just 74.68, but still pretty good. 74.68 is fairly decent. Okay. Now, this is all well and good if you're doing something as simple as a k nearest neighbor, right? We can also do a naive Bayes classifier, right? And we are going to basically look at, because we just have abnormal and normal. So it's just a simple classification with two outcomes. We can use what's called a Bernoulli naive Bayes classifier, right? Again, what is the approach? Create an object, fit, predict, and metric. So this is me creating the object. I call fit, I call predict, and then I print the accuracy. Okay. Now in this cell, I'm actually combining multiple things. There are two factors out here that I'm going to play around with. One is this thing called binarize, which defines beyond a certain value when you classify something as a 0 versus a 1. And the alpha is, I think, for the Lagrangian smoothener, if I remember correctly. I don't remember the details, but I think that's what it is. So in the first cell out here, I want to go through a bunch of different values for the binarized parameter, and I get, some variation in the accuracy. Then I want to vary different values of alpha, 0.01 all the way to 10. Out here, it was just randomly set to 5, right? And then I get a certain number of values, right? So, okay, so then is that enough, right? And of course, you can imagine it's not enough. And if you guys have played around with mesh grid with in Matplotlib or in MATLAB, you'll see what's coming next. I'm going to instantiate an object called grid search CV, right? And what that's going to do is I give it an object of type Bernoulli naive Bayes, and then I give it a dictionary. I give it a bunch of values for alpha, a bunch of values for binarize, right? I define something called cross validation, which we don't have the time, so I'm not going to talk about, but it's a very interesting topic. I define how we calculate the scores. And right now I'm setting verbose equal to 2. We'll run this with 2 just so that you'll see what it's doing. So essentially what it's going to do is when I call fit, it's going to take the cross product of every value of alpha with every value of binarize. So when I run this, it takes alpha equal to 0.001, binarize equal to 0.001, 01, 0.1, and so on. And each one of these is running 5 times. That's that cross validation equal to 5 approach that we saw. Okay. This is of course a lot of data. I can just set this to 0 and run this, and it just runs it, and it says, okay, what's important? So yeah. So this is telling us how grid search CV was set up, right? And then I can print all the results that are available, the keys and values. And I can also print what are the best parameters. So when I run this, I won't go into all of these, but if you look at the best values, it says alpha 0.001, binarized 0.1, right? So what I wanted to demonstrate out here is, this is how you could easily vary multiple, and it doesn't have to be just 2 parameters. You could have 3, 4, 5, whatever, and grid search CV will explore that entire space for you automatically. Out here, what I had done was I manually put in 2 for loops. One for binarize, one for alpha. And then if I wanted to do the cross product, I would nest these for loops one within the other. But grid search CV just does that for us. It does a k-way cross-fold validation, and it gives us the results, right? Okay, so that, I guess I can just run this at the end. If I run with 0.8001, whereas if I take binarize equal to 0.1 and alpha 0.001, not too much better, 7193. So it looks like k nearest neighbors is much, much better than a Bernoulli knife Bayes model, right? Okay, so good. I wanted to stop at this point. And like I said, I was basically fooling around with this and trying to take the Fourier transform of the data and then do k nearest neighbors on the Fourier transform, on the frequency spectrum. But I'll save that for another day, right? So to summarize, and then I want to spend the last few minutes, with questions and discussion, open discussion. But to summarize, my goal out here was to say that, look, if you want to do machine learning or AI techniques in the biomedical space, Python is a fantastic um, uh, language to use. It's easy to understand. It is not easy to program in. It's like any other language. You need to practice, you need to develop the skills in order to do well with it. The good thing about Python is that you have a huge number of libraries available to you that you can leverage, like the way we did just now. And okay, somebody is asking for remote control of my screen, which I'm going to decline. Anyway, so there's a huge number of libraries. There's a huge amount of documentation, and you can go in and you can ask questions. There's a very active community around this. We also looked at things like Kaggle and PhysioNet, where you can try out different data sets. You can see what other people have done. You can learn from them as well, right? Let me end with one last link. If you guys are interested in improving specifically your Python language skills, there is a fantastic website called Advent of Code. Advent of Code. This is where I really learned Python. I mean, there are all of these, HackerRank and LeetCode kind of stuff, but this is the best place to learn how to program. My Python skills developed a lot because of this. It's going to start, it runs from December 1st to December 25th every year. The organizer posts 2 problems every day that you try to solve. And every time you solve a problem, you get, you can, let me just go to previous years. Let me just do this. Every time you solve one problem, you're shown the other problem. Last year, I went all the way to 14. The problems at the first level are extremely simple, but they get very difficult, very hard. So if you look at the leaderboard, or sorry, the stats out here, right? The first 2 problems, most people are able to solve, like 96,000, 72,000. I went all the way to 14 and then I got busy, which is why I didn't go any further. But we went down from 96,000 to 10,000. And above this, only about 2,900 people have actually solved all 25 days of code. These are tough problems, Okay, don't take it lightly. But if you want to learn how to code, it's not just this particular problem that you're trying to solve, but there is an entire Reddit, Advent of Code Reddit, where you'll see people post their solutions or a link to their GitHub accounts with their solutions. And what I used to do is I'd go ahead, take that particular problem, solve it my own way, however I felt was the right way of doing it. And then I would go and look at how other people had solved it. And I learned a huge amount of stuff like that. So if you're just interested in Python, this is fantastic, Advent of Code. By the way, people, this isn't a Python thing, right? You can solve it in any language you want to. And there's no prize or anything. You're just doing it for fun. And so, you know, people have done it in Node, TS, I guess that's script. You'll find people doing the usual C, C++, Haskell. Somebody did it in Excel for all I know. I don't know why. So, you know, Node.js, C#. So people do it in all kinds of languages. The point I was trying to make is I learned pure Python just from this website, right? By solving, not from the website, but by the practice of implementing stuff. Similar to that, I highly recommend Kaggle and PhysioNet, mainly, you know, so that you can look at how other people have approached problems, so that you can learn from them as well, right? So yeah, so this is basically everything I wanted to talk about, and I guess over to you guys, and happy to have a discussion, answer any questions, of course, but also have a discussion about what you guys are working on. And if you feel this has been useful, please let us know, because we're going to be doing something similar for the next FDP as well. So your feedback will help improve and fine tune what we're doing. All right. So open mic, over to you guys.
Hello, thank you, sir. Sir, there are few questions. I will just take these questions. The participant's question is, please tell us some resources to get hands-on session on CNN since I'm new to DL, deep learning.
Okay, that's an interesting point. So this was actually supposed to be a hands-on session, right? But yeah, I mean, the challenge is, you know, well, for the kind of FDP that we're doing, where everything is remote, it's really difficult to do it, you know, in a true hands-on manner. We'll be sharing this notebook with you. So please take this as a starting point. Other hands-on things, the best thing I would suggest is what I've been saying. Go to PhysioNet, go to Kaggle, and just try some of those problems. Look at how people have solved them. Implement your own softwares. In the end, the only way of learning how to do this is to actually do it, right? Your first efforts are going to be really, really bad. Things will improve, right? But that's all I would say. I mean, you just have to practice. That's the main thing. If you look at specific resources for deep learning, just, you know, I mean, there are so many, I don't even know where to begin. My go-to resource is there a mixture of courses on Coursera, on edX. I forget what other platforms there are. And what you can do is, you know, the reason why I don't want to recommend a particular course is because when I got into Python and machine learning, the kinds of courses I found useful at that time, I probably won't find useful now. Right? The kinds of courses I find useful now may not have been right for me when I was starting out. So, you know, people have different ways of presenting, people have different challenging versus easy assignments and so on. So what I would recommend is just try 4 or 5 different courses for a couple of weeks, figure out which ones you like and just focus on those and try to learn from them. Right? In addition to these online, you know, specifically the online courses, the courses that Harvard, UC Berkeley, and a couple of other universities, they provide all of their course material online. So you can look at the assignments that they are giving students. You can look at the kinds of things that their students are doing and try implementing the same things yourself as well. Right.
Yes.
So I'm sorry, I don't have like one particular answer saying, oh, go and do this, because it varies from person to person. Just try out a ton of different things and see what suits you the best.
Yes, sir. Sir, one more question. As you have cleared many doubts when the session was going on, there are only few questions, sir. And you have nicely explained those with the help of the answers to the participants. The question is, what care should be taken while collecting the database? Is there any standard set of rules?
Okay, so that is an extremely broad question. So okay, let me answer that at two levels, right? So one is of course related to the domain that you're working in, right? Your the data that you collect has to be useful for the domain that you're working in, right? And that is something that only you and the doctors can identify, right? Um, for the other part of what came to mind is when we are working with biomedical data, we've got to be really, really careful when it comes to patient privacy, right? We want to make sure that we don't expose personal information in public to other researchers. But at the same time, we want to have enough control so that we know we are doing the right things with the data that we have, right? So yeah, so I think those are the two things. They're kind of very different things, but we need to pay attention to both of them, right? So yeah, I think that's all that I can say about it. When it comes to the actual data and what care we've got to take, it's basically you've got to. It depends on the problem that you're trying to solve. So I can't really directly answer that question. But of course, with all things machine learning, one obvious thing is don't use your test set to train your models, for example. I mean, that's like a commonsensical thing. But yeah, other than that, privacy is very important. Right. The other challenge is a lot of this data is pretty difficult to come by. Like if you want labeled data that corresponds to, let's say, Alzheimer's disease, right? How the heck are we? I mean, how do we even go about collecting that data? So that's always a challenge, but that's what we have to try to work on. So one of the places where I gave this talk, we actually agreed on trying to work together on building a database ourselves for a particular problem where a database doesn't exist. So that is also an opportunity for you guys in case you are working on it.
Thank you, sir. Sir, the next question is, to achieve highest accuracy, there are various classifiers as such. So, which will be suitable? And is there the only possibility that with the trial and experimentation only we will get the result, and then we'll decide that which is the best one?
Yes. So in fact, you've answered the question in that question itself, right? The problem with a lot of, so first of all, the right classifier depends on the type of data that you have, right? In some cases, you might want to use a decision tree, or maybe something as simple as a nearest neighbor is fine. Or you might want to do a Bayesian classifier. In some extreme cases, you might want to use a deep learning based technique, right? And then you have all kinds of neural networks with all kinds of features. So it just depends on the kind of data that you have. The best approach is to try different classifiers, see which one works the best, right? And that's why I said you kind of answered the question, as part of the question itself. As you get more experience with classifiers, you start playing around with the data and you start saying, okay, given what I've seen of the data, this particular classifier is going to be better than that, right? Finally, the challenge with a lot of the latest technologies is that we suffer a lot when it comes to the notion of interpretability, right? So for example, if we have, let's say, a decision tree, right? We can say that this particular test was classified as group 5 or 6 or whatever because of these values of its features. We can look at the decision tree and understand why a particular answer was given. But if you look at a neural network, it's like a, some magic happens and we get an answer, right? And it may be true, it may be false. So there is that challenge when it comes to using things like neural networks versus something simpler like decision trees and naive Bayes and so on. So my general recommendation is, neural networks are like the buzzwordy kind of models right now, but you don't have to use neural networks for everything. A lot of times, simple models do just as well. And the good thing about simple models is you can explain, you can interpret the results, which you can't really always do with neural networks.
Yes. Thank you, sir. With this, we are now at the end of the session. Very excellent session, sir. Very informative session. Good afternoon, one and all present here. On behalf of JSPM's Rajarshi Shahu College of Engineering, Department of ENTC, I, Dr. Swati Vesikar, take this privilege to propose vote of thanks for today's eminent personality, Dr. Shrirang Karandikar, sir, for conducting live, hands-on, I would say, hands-on informative session with actual real-time demonstrations, code descriptions, various database examples, and you have also demonstrated what all the open source, what all the conditional databases available. So very, very excellent session. I'm sure that the participants are greatly benefited by your talk. We are really enlightened with your knowledge and presence. Thanks a lot, sir. Thank you very much.
Thank you. And
Yes.
I'd appreciate any and all feedback that you guys have. Thanks for organizing this seminar, and all the best to all the participants as well.
Thanks a lot, sir.
Thank you. And I'll email you the notebook that we have, so you can just distribute it to everyone on the call.
Yes, sir.
Right?
Yes.
Okay. Thank you and goodbye.
Yes, sir. Thanks a lot.
Yeah.